Good morning. Just coming on today and wishing everybody had a very Merry Christmas and all the best in the new year. The reason we're on the station today is that we've seen a sharp increase in our COVID numbers and cases and contacts. So case numbers have increased sharply and we must again take steps to reduce the spread of the virus. Omicron is now the dominant variant. The incubation period is just 3 days. So this is the variant that we are dealing with. So again, coming back to the community with all the previous public health orders that we had. And again, I'll go through those with you. People remember to follow the best practices when out and about, and even wearing a face mask in public. Maintain social distancing. Clean commonly touched surfaces. Frequently wash hands for 20 seconds or use hand sanitizer. Avoid contact with sick individuals. Stay home if feeling sick, even if mild symptoms. And limit carpooling or traveling in vehicles other than your immediate household family members. If you must travel with individuals outside your immediate house, please wear a mask. The other reminder that we want to put out there is security measures. Private indoor gatherings are limited to 10 additional people plus the household if all are fully vaccinated. Youth age 12 and under are exempt. Private indoor gatherings are limited to 5 additional people plus the household if any of the individuals are eligible but unvaccinated. Youth ages 12 and under are exempt. So again, we're discouraging large household gatherings and parties. This is where COVID can spread very easily with the close contact. So that's the reminder. I want to let the community know that we are doing COVID clinic today for all ages. We're doing the first vaccine, second vaccine, and third. The eligibility now for the third dose is 18 plus, and there is a timeline of 5 months between the second and third dose. So we encourage everyone that can get out there and get their third dose. Please come out. 5 months is the timeline between the second and third. For the children, please bring them in for their first vaccine or second vaccine. That's a 5 to 11 age group. We're also doing the 12 to 17. So again, we are at the community hall today doing vaccines and encourage everyone to come and get vaccinated. This is our protection against the COVID-19 that is circulating in the community. One of the other things I want to let the community members know that this self-rapid tests are in the community, but we are working with education to get those kits out. The eligibility is from nursery to grade 6. Right now we're working with education on how to get those individual tests to those students. That age group was identified because of their higher risk of not having the vaccine. So again, we are trying to get those vaccines out to those school children in that age group from nursery to grade 6. We're hoping to have those out soon. So with working with education and trying to get the kits out to individuals, they are 5 tests in 1 kit, and they're all self-explained. Instead of having to go right up the nasal, they swab around just the inner part of the nasal. And if need any explanation or any questions, contact the COVID hotline. Right now I have the nurses over at the community hall, but we also have nurses that are doing the contact tracing. We have a lot of contacts. And when we talk about contacts, I like to remind all community members again that when you're named as a contact, you are to go into isolation. The household that you are in, the whole household also goes into isolation. We've had some calls and questions about that, but the direction is that if you are a contact and you're got a house full of other people. All those other people are now under isolation. So any questions, again, contact the hotline. But that is the direction from public health at this time, is that all household contacts are to be isolating also. So again, I'd like to thank you and keep safe, and please get your vaccine. Thank you.